The unilateral PA, again the starting position is exactly same as what we did for the central PA. The patient is lying on the front. The therapist is standing next to the patient. If I'm standing on the right side of the patient, then the glide you need to apply on the right side facet joint. If I want to apply the glide on the left facet joint, then I need to come on the other side to assess the left side facet joint. If I'm applying glide to the right side facet joint, do you know what is facet joint? Yes? Yes? If you're going to assess the function of the facet joint of the right side, you need to stand on the right side, and then the hand position, so the plinth height should be slightly below than the hip height, because you're going to use your thumbs to apply the glide. So I normally bring the height slowly below than the hip height. Just 1 second. So that's below than normal height for central PA. If I'm using central PA here, for unilateral PA it's slightly below. I'll tell you why. So once you position the plinth height, once you adjusted the patients, then the technique is you're going to use your pads of your thumb to apply a PA glide. You're going to apply a pads of your thumb to apply PA glide. So in order to apply the PA glide on L5 S1 facet joint, first thing is to palpate the spinous process. Once you palpate the spinous process, it's 2 finger breadth away from the spinous process, and it's just below the spinous process. Do you remember? We saw that last week. 2 finger breadth away from the spinous process, and it's below the spinous process. Below the spinous process. Can you see? So once you reach the facet joint, your fingers are spread across to the erector spinae muscle group, and you're pulling the muscle group together with the fingers. So thumb is on the articular facet, yeah, but the fingers, the other 4 fingers or 8 fingers, it goes across to the erector spinae and then pull the muscle together. So the tension in the muscle, the tension in the fascia decrease. By pulling the tissue together, you're decreasing the tension in the fascia. By decreasing the tension in the fascia, you can glide the joint much more better if you don't apply the tension. You with me? If I don't pull, if I just keep my fingers up like that, it's less effective than if I pull the tissues together and then apply the PA glide. You with me? So, and then once you position your fingers on the articular facet, my shoulders both are above the facet joint, not away from the facet joint, and it's slightly straight above the facet joint, and then applying a PA glide from the shoulder, keeping my elbow straight, and then pushing from the shoulder, hold my body weight using that folder, and applying grade 1 to grade 4. Checking the right side first, or checking the unaffected side first, and then go on and to do the affected side and check the left side L5S1. Got me? And then once you complete the L5S1 segment, come on to the L4, L5. So in order to do the L4, L5, you palpate the spinous process. The reference to reach the facet joint of L4, L5, it's 1 thumb breadth. Am I right? It's 1 thumb breadth from the tip of the spinous process, and it's slightly below the spinous process. Once you identify the location of the facet joint, again place your pads of your finger onto the facet joint, pull the tissues together, shoulder above the facet joint, and then you're starting to apply grade 1, 3 oscillations. Check with the patient. If that's pain-free, move on to grade 2, larger amplitude of oscillation, hitting the R1 point. Check with the patient to see if that's okay. If the patient is comfortable, no symptoms reproduced, progress to grade 3. And then grade 3 is a larger amplitude of oscillation going towards R2 point. Check with the patient and see how they feel. If the patient feels comfortable, then you move on to grade 4. Hitting the R2 point. When you hit the R2 point, if the symptoms not reproduced, then good, you're clearing that segment and moving on to the next segment.